And that's the last thing you want in an assisted living community is have somebody to go ship off to a hospital, pick up an infection and bring it back to the rest of your residents. So it's a challenge. So it was a need I had. And when I got a call about this company, it just made too much sense. And I jumped in.
Welcome to the Row Room Assisted Living Podcast with your hosts, 𝐵𝐻𝐺𝐻𝐿 and Alex Schloe. This is your go-to show for cutting-edge insights from industry leaders in residential assisted living.
Whether you're ready to launch your own assisted living business or looking to invest in this fast-growing, high-impact sector, we are here to equip you with the tools, strategies, and confidence you need to succeed. Get ready to ride the silver tsunami and change the future of senior care. Now on to today's show. Hello, everyone. Welcome back to another episode of the Row Room Assisted Living Podcast. Today's episode is going to be a little bit different, but it is one that we're really excited about because we're talking about the future of care inside the home. Today's guest is Lon Hecht. He's the CEO of 𝐵𝐻𝐺𝐶⁴ and a healthcare executive with over 25 years of experience scaling innovative healthcare companies. His background spans leadership roles at Optum, Teladoc, and other major healthcare organizations. He has a deep expertise in value-based care, home and community health, and digital health. Today, Lon is focused on transforming how care is delivered by bringing hospital-level care services directly into the home, helping residents receive higher acuity care without leaving their home. Lon, it's so great to have you on the podcast today. I'm really excited. This is definitely something that is very intriguing to me as a physician. And obviously, we love seniors and providing exceptional care for them. So excited to have you here on the podcast.
Really appreciate you having me on. And I'll say equally, I'm excited about residential assisted living. So it's something that I've looked into and something that I do believe I will do in the future. So this is perfect.
Awesome. Yeah, looking forward to it. I love the blend and the melding of different things. And that's what's so amazing about having a podcast is being able to build these relationships and talk about different things and learn about a lot of different things. Lon, do you mind giving us a quick overview of who you are, what 𝐻𝐺𝐻 is, and what you're building right now?
Yeah, sure. So you gave a good background. I'm a healthcare leader. Typically, have been on the growth and business side for probably closer to 30 years, I hate to admit. And I started working with 𝐻𝐻𝐺𝐻 about 2.5 years ago. And we're a very different company. We're in what you would call the high acuity care space. So think ER and hospital level care. But we're really different in the fact that we deliver that in the home or in the community, in an assisted living type of community. So what's really cool is we can deliver that care typically within 2 to 4 hours of getting notified, be in there, most likely stop an ER visit. And if the patient needs ongoing care, we can actually hospitalize them. So this grew out of a need that I had when I was at Optum. I don't want to talk over folks' heads here, but I basically had a need. And it was, we were going to other health plans to take on full risk for their membership. And there were a lot of good things that we could do, but one place we just couldn't control was ER and hospital level spend, and it's out of control. And you find that half of the things that go to the hospital don't need to be there. It's very costly, and you're putting people around a bunch of sick people, right? And that's the last thing you want in an assisted living community is have somebody to go ship off to a hospital, pick up an infection and bring it back to the rest of your residents. So it's a challenge. So it was a need I had. And when I got a call about this company, it just made too much sense. And I jumped in.
Yeah, it is an enormous need. The current reality typically looks like residents having to go to the ER for things that they don't necessarily need to, and then they get admitted, and then you have these hospital transfers and disruption of families, and that's not even hitting like the cost and risk side of things. What have you been saying in terms of reality, and then also how you guys are helping to solve that?
Yeah, first of all, I see way too many things happening in the hospital that shouldn't be there. And it's not a great experience for folks. I don't want this to sound like I don't think hospitals are great, because I think they are. And I think they're appropriate for certain levels of care. There are certain things that just don't need to be there, right? Your typical pneumonias, your UTIs, complicated UTIs, a COPD exacerbation, CHF or congestive heart failure exacerbations, things like that could be treated very comfortably in the community at a significantly reduced cost. So if you look at your typical member, I'm assuming they're Medicare age for the most part. And if you look at a Medicare hospitalization or ER visit, it's typically 3 times more expensive than the care that we provide. And people prefer to keep that care in the community. So we're able to bring a lot of capabilities, and we can talk about what that looks like in a few minutes, but we can do stat labs, we can bring in oxygen, we can do imaging, we can do EKGs, we can do point of care testing, we can do minor surgical procedures, all kinds of things in the community.
That's amazing. Yeah, I'm really excited to talk more about the capabilities. And I think it's also important to really stress that this broken model, and for folks listening, they've probably heard me rant about healthcare and the broken healthcare system many times. So I won't get too much on a rant, but it is broken. It's inefficient, it's expensive. And you even throw the complications in there of seniors, right? Like the difficulty of just getting to the hospital, unless it's EMS, is incredibly difficult for some seniors, or getting follow up with their primary care doc. And we see, as you mentioned, Lon, like so many folks going to the ER for not emergent reasons, and that puts a drain on the system, costs so much more money. And honestly, it's frustrating for doctors as well, especially the ER docs, because they're there wanting to treat emergent conditions. And so it's just, it's a win-win what you guys are doing as a whole. And so I think that's just really important to hit on. And it sounds, correct me if I'm wrong, sounds like an extra tool and resource for folks in the assisted living environment to help keep them where they are and provide great care, even if they need a higher level of care.
It is. It's just a great tool to have in your toolbox, like you said. And if you think about it, my mom is currently in assisted living and she is in a Sunrise community, which is a lovely place. I had wanted to start as a residential assisted living, getting ahead of this with my mother. So I had a place for her and also potentially other family members as a way to defray the cost. But when you think about it, if you're in a community like that, it's not just what kind of impact it has for that one resident, it's what kind of impact does it have for others. It is not good for the psyche of the folks that are in assisted living to see ambulances coming left and right. And it just reminds you of the mortality and the situation you're in. I just think it's a terrible look. When I go to her community and I see that, I just think to myself, like, it's just constant reminder. And it's hard when you're older and you're in a community like that. Like, you're there for a reason. You don't need those kind of constant reminders. And that's what scares me about my mortality when I get older is the constant reminders like that.
Yeah, no, that's a great point. I was an EMT before I went into med school. I did it while I was in college, and we very commonly frequented the different assisted living facilities. And oftentimes we're seeing the same patients. And sometimes it was just like a staffing issue. They didn't have the staffing that they needed to provide exceptional care for folks, which then led to poor outcomes. Or home health couldn't handle the situation, or whatever that may be. And there's a lot of different steps that lead to that process. And that's part of the reason why we love residential assisted living so much, is it does provide some more personalized care, typically better staffing ratios, all those sorts of things that can be helpful at reducing ER visits or the need for hospitalization, but it still doesn't solve a lot of the problems that exist from that perspective.
And you probably have home-based providers that are coming into your communities, and we become a wonderful escalation point for them. We're not longitudinal providers. And to your listeners, that means like a primary care provider that's seeing you over the course of years and years. So we're not going in and doing routine checkups and things like that. We are complementary for them. So if they're in there and they're seeing a patient and the patient has something that's higher acuity, higher need, they can call us and have us come in directly. We get tons of referrals from doctors. We get tons from care managers, geriatric care managers, home health agencies. One thing that I think listeners would like quite a bit is when you actually do have a community member that is in the hospital, sometimes they're trapped in the hospital because you can't get home health in. That is a huge challenge. Like in some markets, it can take 6, 8, 9 days to get home health in. We can bridge that gap to home care so they can come out sooner. And that's a win for everyone.
Yeah, that is huge. I know when I was doing inpatient more regularly, we had plenty of situations like that where, hey, this patient's medically stable for discharge, but they can't go home because maybe they have a PICC line or they're getting IV antibiotics or something that requires home health. And they're stuck in the hospital until they are able to safely return home. And then they're stuck with that hospital bill too, which is massive. And our insurance and Medicare is stuck with that. It is a huge need. It definitely saves everybody a lot of money from that perspective. And we know that demand is exploding as the population ages. We're going to see higher acuity residents entering assisted living. This is going to become more and more needed. And I wanted to hit one other thing you said, Lon, is there's a lot of times in clinic for me when I'm thinking about seeing patients, and you have that patient that comes in and they look sick and you're like, I don't know if this is safe for them to go home, but I don't want to send them to the ER. And we live in an age of defensive medicine. And a lot of times you're sending folks to the ER that maybe don't need it if they had the follow-up that they needed. If I could see them on Monday, or when I saw them previously on Friday, and just see, hey, let me check in and see how they're doing. But access is such a huge issue in primary care clinics that a lot of times you have to be like, hey, it's the end of the day on Friday. I'm going to have to send you to the ER. We need to get labs. We need to make sure you're being seen. And it just breaks my heart to have to do that. And there's certainly situations you have to, but otherwise it's, man, what if there was a solution where you didn't have to do that and you could guarantee follow up? And it sounds like this is potentially one of those solutions.
It really is. One of our busiest times, or I would say our busiest time, is between 3 to 5 o'clock on a Friday afternoon, where the discharge
Yeah.
planners are starting to freak out about what am I going to do with these patients over the weekend. So we get tons
Yeah.
of calls. In a situation like that, first of all, we could go in and we could evaluate them and we could do the labs and everything in the home. It's amazing what we can do, the level of labs we can do in the home, and we can turn those labs typically in 4 to 6 hours, and that's not even including our point of care testing there. So that's one thing that we could do. We could be in the home, you could send them home or back to the community, and we could head out there, meet them. But what's really nice is if we discover a change of status, we can always come back the next day, right? And the way our model works is everything starts with this ED avoidance, emergency department avoidance type visit, where we go in and it's like bringing the ED to the home. We don't bring everything you have in the ED, that would be impossible, but we bring
Yeah.
a lot of what's in the ED. So we work the patient up. In our model, I should tell you what it looks like. We send typically, and it depends on what market you're in, but typically it's a physician assistant, a nurse practitioner, or a paramedic. Some markets, it could be a nurse into the home within 2 to 4 hours. Then they work the patient up and bring a physician on concurrent telehealth. Usually that physician is an ER physician or a hospitalist. We employ them all. And it's 2 providers on a visit. Now, if you think when you go to the ER, you probably see a provider for 5 minutes if you're lucky while you're there. We're spending about 70 minutes with them, right? So the person in the home is spending about 70 minutes. The person on telehealth is probably spending about 15 minutes with them. But they put together that care plan and they implement it and get everything that's needed. And if the patient requires ongoing care and they meet guidelines for in-home or for observation or hospital level care, we can just admit them right in the home. Now, keep in mind, we're not admitting them to a hospital because we're not a hospital, but we're providing hospital level care in the home. And what's cool about our service is I've contracted with a lot of health plans. We're not contracted with all of them yet, but I'm working and I'm getting there. The way we've contracted is they're paying a specialist copay for our services. When you go to the hospital, you're paying an ER copay or an observation copay or whatever. It can get crazy. And if you look at Medicare and you're on traditional Medicare, if you don't have a Medicare supplement plan, you're paying 20%. If all of a sudden you're going to the hospital and it's a $15,000 admission, that's $3,000 you're on the hook for. You're going to find, because our service is so much less expensive, the amount of money they have to pay out of pocket is typically significantly less. And we're super upfront about that when they call in. We'll understand what their insurance is, let them know about the costs up front. The worst part is when you go to the hospital, you just don't know what those costs are for a month or two, if you're lucky. And then there's nothing you can do at that point. So that's how it works. And then we do full care coordination around them. We'll follow them for 30 days. We do remote patient monitoring if they're admitted. I think the biggest thing is that we do full follow-up with their doctor, with their primary care doctor or the specialist that referred them. So they're always getting call notes, but we will literally, if the doctor wants us to, and we ask, we'll call them after every visit and let them know exactly what the status is and what's going on. So it's really important. We really help with the care coordination. Whereas if you look at the hospital, a lot of doctors, you may say this, it's like a black box. You just don't know what's going on when your patient goes there. We try to keep people really informed because it's
That is
important for
awesome.
care continuity.
Running a residential memory care home is not just a calling, it's a maze of licensure, paperwork, zoning regulations, and day to day challenges that can feel overwhelming. That's why so many successful operators partner with Legato Living Franchise. Legato Living does more than just help you open a home. They help you open it the right way so you can stay focused on what matters, providing exceptional care to those living with dementia. And once your doors are open, it can get lonely at the top. As a Legato Living franchisee, you are never on your own. Legato Living offers ongoing operational support, from staff training and owner conferences to systems, cultures, and quality assurance, because a home is only as good as its operator, and great operators deserve a great partner. If you're ready to open a residential memory care home that truly makes a difference, visit Legato Living and start with confidence today.
100%. Yeah. And so many things happen in the cracks there of care continuity. Someone's discharged from the hospital. The note says follow up with their PCM in 24 to 48 hours. In reality, they can't be seen for a couple weeks. And it's like, what's happening in that gray zone? It's difficult. And a lot of that is communication. And so I love to hear that as a family med doc. That is absolutely incredible. Let's talk a little bit more about the capabilities. And this is something
Sure.
that I'm going to nerd out on as a physician, but what capabilities do you guys bring to the home? Diagnostics, treatment capabilities? What are some of the more common admissions to their home? What does that look like, Lon?
Yeah. So once again, I am not a clinician, and I mentioned to you before, so I never want to get out over my skis. But we do a full workup. We're bringing in typically oxygen concentrators, which we can even leave behind if need be, right? So if someone has issues with COPD or something like that, we can help with that. We're doing stat labs, so we can get very detailed on our lab panel. We can turn those very quickly. We're doing that point of care testing. I mentioned some minor surgical procedures. We can bring imaging, EKG, things like that into the home. Typically with the imaging, we have contracted partners that we bring into the home just because it's not natural to be able to bring all of that equipment into the home, but we can turn that very quickly. We're doing DME ordering, we're doing full e-prescribing, full care coordination around the member, all of those kind of things. And I'll just mention that some of the things that we treat, we're doing a lot of things, like I mentioned, cellulitis, COVID, flu, pneumonia, complicated UTIs. I may have said that, kidney infections, DVTs, COPD, CHF, congestive heart failure. I feel like not everybody knows what that means. We can go pretty deep, and that just scratches the surface of what we do. What I really love about what we do is when we get a call, we get calls from the patient, we'll get calls from doctors, from care managers, home health agencies, assisted livings, all the way through. We are more than happy to triage up front because I want to make sure a couple of things. One is, if you're too high acuity, I want you in the ER, like quickly.
Right.
We don't want to waste time on that. Two, if you're too low acuity, I want to protect everybody here. I don't want you or your plan or anyone else to spend more money than you should. If you're low acuity, I'm going to try and find a way to get, if you're in a community and you're not mobile, try and find a way to get a provider that can come in that's a lower level of care than us to be able to provide that care. Because I really pride myself on being, we talk about this in healthcare, and I'm a health plan geek. I've been doing that forever. And a hospital person, I know this. You've got to be good stewards of the MLR, their medical loss ratio, their dollars, right? So that means you can't bring a gun to a knife fight all the time, right? So I have to make sure that I'm getting people to the right level of care. And I think that's what we do really well.
Yeah, I love that. And so many seniors are in that position where it's like, maybe not appropriate to wait for your PCP visit. Urgent care is probably just going to send you to the ER anyways. And so what do we do with that in between? And that is huge to have those capabilities. Really awesome to hear. What does it look like for someone you admit, say, I don't know, we'll say that they're on IV antibiotic management and for cellulitis or something like that, and they need continued follow-up with a provider or someone of their care team. What does that look like if it's an extended quote unquote stay with Care to You?
Yeah, sure. So we'll do that initial visit. We will get them set up. We will admit them to our service for what we would consider, we call hospital level care at home. And they would get 1 to 2 visits per day, at least one in person, often twice in person, depending upon their need. If that second one could also be telehealth if need be. And we would continue this course of antibiotics for them. Now, here's the key. What we would do is when they are stabilized, we would try to partner with an infusion vendor to bring an infusion vendor into the home to be able to take over that case, because that's going to be lower cost, right? Or
Mhm.
I shouldn't say into the home, into the community, but you know what I mean. I
Right,
consider the
right.
home the community
Yeah.
for in this situation. So I just want to make sure that, just like anything else in healthcare, a hospital costs this much, we cost this much, infusion costs this much, home health costs this
Yeah.
much. So what I want to do is I want to make sure that I have you stable in the right level of care for what you need, and I don't want to overstay my welcome. I want to make sure that we're doing what we need to do to treat you. And the other thing is, we're going to follow you for 30 days. So you can reach out to us. We do remote patient monitoring. I didn't mention that. So we're making sure that if there are any kind of changes in status, we can monitor those remotely, so that if an escalation or anything needs to occur or a doctor needs to intervene, they can very quickly.
That's great. Yeah. And I'm sure, yeah, remote patient monitoring, probably telemetry and those sorts of things too, that could be really helpful. That's awesome. That is great. For an assisted living operator who's listening to this, of course, we have a lot of folks who are operating assisted living homes or getting ready to get started. Why should they care about this service for the residents?
Yeah. So first of all, I think it provides a much better experience overall. I already mentioned the psyche of seeing the ambulance pull up in front of the community, not a good look. The other thing that I worry about for their members is when they end up going to the hospital, what are they going to bring back with them? That's scary, right? You do not want to get a reputation as a place. We know what happened during COVID. It wasn't good for anyone in the industry. So you want to be protective of that. So I think the big thing is they'll have a service that can come in and help manage much higher levels of care in the home or in the community. And that's what patients want, right? Now, one thing I do want to point out is right now, Care2U, we're in the New York market. We are very well financed, but we're going to do some additional fundraising to start moving into other markets. I have my eyes on 3 to 5 other markets in the next year or so that I'd like to be in. We're not going to be in all markets, but I want to tell your listeners how I would approach looking for this in your market, because this is more about educating folks on what's available than on educating you about Care2U and the fact that you need to use this. So what I would do is, first thing I would do is I would talk to some of the providers in the community and I would say, are you familiar with any urgent care providers that do urgent care in the home? You might also call that mobile urgent care. I'd search for that on Google in your geography, your county, mobile urgent care in the home, all of those. That is a great starting point. Now, to be clear, mobile urgent care is going to be this level of acuity. We're next level acuity.
Mhm.
There really that I know of are not any other folks out there doing the level of acuity we're doing. But I welcome competition in this. We need to change healthcare. We need to change the trajectory of cost in healthcare. We're doing a great job. If you are a provider group somewhere else in the country and this is something that interests you, reach out to me. I'd love to help you guys figure out how to get started. We might even be able to do something together, right? I want to be able to expand this. So just know that mobile urgent care in the home, good starting point. Then I would start asking, okay, what's next level? So there is something called hospital at home that I'll mention to your listeners, but it's a program that is only for, and I don't want to confuse folks, it's only for straight Medicare or fee for service Medicare. And the way it's set up right now is a patient actually has to go to the ER, put their 6 hours or whatever in the ER, meet criteria, then an administrator has to want to send them home rather than fill a bed. Doesn't really work that well. There's not a lot of cost savings in it. It was a COVID play, right? But it
Yeah.
did get extended and it is there in certain markets. So it is something that could be available, but you got to go to the ER for it. We've changed that model completely. Our model is we go in the home, ED in the home. If you need to be admitted, we just admit you right there. So it's a much stronger model from that standpoint. But just know that you could look for a hospital at home in your market as well. There may be a hospital that provides that, but unfortunately, the member is still going to need to get transported over there and you're going to have to put that time in. And that doesn't keep you away from infected individuals either.
Yeah, for
So
sure. It's
those are the things
huge.
I think about. I really want folks to lean into this model. I think it's fantastic. More people doing it, the merrier.
Yeah, absolutely. There's so much need for it. It's the same thing in the assisted living spaces. As we see this boomer generation age, as the country ages so much more, there's such a huge supply demand mismatch already for assisted living. Obviously, those are seniors who are going to need higher acuity medical care in an already very strained and taxed medical environment that's only going to get worse, that we need more and more services like this. And so I love that there is a lot of opportunity in this space, as there is a lot of opportunity for assisted living all the time. Whenever we're doing a webinar or something like that, we're like, the more people who know about this, the more homes that open. If everybody who is on this call or everyone listening to this podcast opens a residential assisted living home, we're still going to put a small dent in what's actually needed. I love that abundance mindset, that willingness to give and help out others. I love that. So I really appreciate that, Lon.
My pleasure.
This is great. What does it look like for operators to enroll in Care2U if they're in the New York area or work with you, or is it more specific for the individuals themselves?
Yeah, so we could just start seeing your patients. We don't have to contract with you or anything like that. We're a service that's available. So what I would say is our website is care2u.com, and that's CARE number 2 letter u.com. It will have our number on there. You can also submit a referral right online. We get back to folks within 10 minutes. And then we're typically in the community within 2 to 4 hours. It's as simple as that. And then we call back, we'll just get basic information, what's the complaint? What is the insurance, things like that, and then we'll move forward. So it's pretty simplistic for folks to get in touch. And here's the other thing. If there are listeners in other parts of the country that are interested in a service like this, hey, I'd love to know. You can always go on, submit a form on our website. My name's Lon. I'm the CEO. You can address it to me and say, hey, I'm in X market and this is really interesting to me. When you get here, let me know. I will add you to our CRM and I'll make sure that we let you know when that service is available to you. And if I know of a service that's available off the top of my head, I'll try and refer over to you to try to be helpful.
That is awesome. That's great. And helpful information for you to receive as you're thinking about growing 𝐻𝐻𝐸 and expanding to other markets. I'm sure if you start getting the same folks reaching out from the same areas, it's a great indicator of the need there from that perspective.
Yes.
So love that.
Go ahead.
Go ahead, Lon. Yeah.
And we have some great contracts with insurance companies and it's doing really well for them, right? They love it because one, access to care is such an issue for them. Two, it actually saves them and their members a lot of money. It's a big win all around. So we have some national insurers that we're contracted with that would like me to move into other markets. So as I hear from other folks in the community, that helps, like you said, it really helps solidify my interest in moving into that community.
That's great. Yeah, I was going to ask the insurance question next, and you answered that there, that you guys do work with multiple different insurance providers and so forth from that perspective.
We do. Absolutely.
That is great. Staffing is one of the biggest challenges that we see in this industry. Do you feel like this would offer the opportunity to reduce burden on staff or kind of change operators' mindset in terms of how they think about staffing and taking on more higher acuity residents?
I think it does. I think it gives a really good kind of safety shield for these high acuity residents to know that they can be managed. I would say it would be a great thing for you to build a good relationship with a company such as mine to be able to reach out. I have a lot of folks reach out directly to me. Of course, I prefer it. Don't get me wrong. I do prefer when folks call 𝐻𝐻𝐸, but I have really good relationships with a lot of our customers. So I get a lot of outreach on that. I do think it allows you to see folks that are more complex. One thing I'll mention is I'm sure you have a lot of folks that do memory care type of facility. I just can't think of a worse place. Very openly, my mother is in assisted living and is having some cognitive challenges. I can't think of a worse place for somebody that has dementia or Alzheimer's than to be in a hospital, something that's unfamiliar like that.
Yeah.
So I think that becomes an incredible selling point for you when you have family members coming in there to be able to talk about a service like this, because most of those communities are just going to send people to the ER. And that's a bad place for folks that have memory impairment. Just terrible. I think it's terrible.
Oh, absolutely. Yeah. Imagine having dementia and already having this kind of decline, and then you're going into an environment where you're being poked, prodded all the time. Your sleep schedule and routine's completely destroyed. I completely agree. It's probably the last place you want to go when you have
nothing
dementia.
Nothing familiar at all. So
Right.
That's really challenging.
Yeah.
Yeah. So I love our service for that. Look, I think we'll be in a position that in 5 years, this will become more of a standard of care. But it's going to take time. Like, I legitimately think everybody talks about what inning you're in. We're in like maybe top of the second on this one.
Yeah.
It's really early. I think we have a really substantial lead here, but it's going to take a lot of companies doing this because the way insurers look at the world, they look at things, they want to look at things nationally. So I get challenged that I'm more regional. And that's why I want to expand out, besides for the fact that I want to provide more care to more seniors. And keep in mind, it's not just seniors. We do see a lot, we're typically 18 and older. We do see a lot of commercial members and others as well. In order to have legitimacy, you need to have enough capability out there across the markets to be able to do it. So the more people that are doing it, the more legitimacy that comes to what we're doing.
Yeah, that is huge. I think this is a huge opportunity in medicine. I think the longevity play and optimization side of things is a huge play in medicine as well. And then, of course, from the senior living side, I think residential assisted living is the way to go from that as well. And so there's a lot of great opportunities for folks to really provide better care for seniors across all these different domains that we really need to be thinking about as the boomers are aging so much more and so quickly. And it's the second inning. The silver tsunami, if you will, just started. It's not even breaking yet. And so there's a lot of opportunity in this space now and for years to come.
Yep. And I'm 53 and I'm getting the silver, man. I'm going to be on that tsunami soon. It's
Hey, you
coming.
got a great head of silver hair. It's great. I am jealous. I'm just losing on mine. So luckily you can't see the back of my
I,
head right now.
I think we're both in the same ballpark.
There you go. That is awesome. Wow, this has been great. What I just want to ask a few other things because it seems
Sure.
like you guys are on the forefront of a lot of these things. What are some trends that you're seeing in the senior care space? Or maybe what are some things that you think would be helpful for assisted living owners and operators to know to provide better care to seniors?
I think the biggest trend I'm seeing is care in the home. And that's just not my kind of care in the home, not just high acuity. It's all things coming back to the
Mhm.
house call. I'm seeing way more of that. So I think there's a lot of value to that. I think there's something that's interesting that assisted living owners should be thinking about is understanding the insurance market a little bit better is actually beneficial because Medicare, and I'm not going to dork out on everybody too much, but Medicare is really broken into two buckets, right? It's straight or fee for service Medicare and then Medicare Advantage, right? And there are benefits and downsides to both of them. But in that fee for service Medicare bucket, there still are people that manage that care. They're called ACOs or accountable care organizations. And a lot of your residents won't even know that their doctor is a part of an accountable care organization. But a lot of those ACOs, because they're responsible for costs, they may contract with companies like mine to cover a lot of those costs, right? So I think it's really valuable to learn a little bit more about the insurance side because I think it's really valuable to your members and to guide them on what the value is. So what's interesting is a lot of the Medicare Advantage plans are actually fully covering our service right now, whereas on fee for service Medicare, there's added cost for it right now. That doesn't mean that I wouldn't absolutely consider fee for service Medicare because that gives you a lot more flexibility too. So I just think that the one thing I would think about if I were an owner is just to understand that insurance market a little bit more. There's a lot to it. And just know the reason I say that is there are a lot of models now that a lot of these ACOs and others are doing with their polychronic members that have a lot of chronic conditions to do care in the home. So I would really look at those models. Like, for instance, dementia, there's now an ACO model around dementia, which is really interesting. And there are some really cool companies out there that have done this. I actually was hosting a podcast about 2 years ago, and I did one with a company called Ripple. And they're one of the providers that does this. And I'll give them a shout out. It's RIPPL. They were just acquired, but they do this dementia model where they actually wrap around and assist caregivers and everything like that. So there are just some really cool things to learn about out there. It's definitely worth spending a little time. So care in the home, I think, is really
Yeah,
and in the community is the big play.
I agree. That is
Sorry, I
awesome.
riffed there a little too much.
No, that was perfect. I was writing, taking some notes as you were saying some of those different resources. I completely agree. I think it is a huge opportunity, and it's only going to lead to better and better care for seniors and decrease spending and better outcomes. We didn't even really hit on some of the hospital outcomes and how some of the care that seniors are receiving is not the greatest from that perspective. I'll ask you, Lon, one more question. What are you most excited for right now with Care to You?
I'm most excited about the fact that we are actually changing the model of care and we're doing it in a way that is really proactive and helpful to seniors, but actually saves a lot of money. I feel like we're hitting it from both angles. We're providing an exceptional experience, we're saving money. I feel like it's just a winner. That's what I'm most excited about. And I'm most excited about expanding more, getting this out into other areas. Because one thing that's interesting about what we did is there are a lot of companies that have come out and tried to do this, and they've gone with models that just haven't been successful. We have right from the beginning. And the reason we've been successful is we've been able to contract with health plans and get them to pay and believe in what we're doing. And it's because our outcomes are superior. So to be able to do that is a real win. So I'm really excited. The biggest thing for me is just bringing this to more and more people. And you mentioned outcomes, and I'll mention this. We keep about 90% of the patients that we see from ever stepping foot on the hospital campus.
That's
Think
amazing.
think about that with the things that we're treating and the fact that we're able to keep 90% of them in the home or community. That's just an amazing thing. And it's funny, you would think hospitals wouldn't love us, but actually they do, because a lot of them are on the hook for readmission penalties, things
Mhm.
like that. We have hospitals that are sending people home and saying, listen, if you have an exacerbation or some kind of flare up, call Care to You, because we're going to stop 9 out of 10 of them from readmitting. So it's a big win there.
Yeah, it is a win-win for sure. And as I mentioned before, it keeps the highest acuity going to the ER, and you guys are able to take care of the rest. So that is awesome. I love that. Lon, how can folks reach out to you and learn more, or potentially inquire about investing with you guys at 𝐓𝐢𝐦𝐻?
Sure. They can reach out to me. Once again, my name is Lon Hecht. I'll spell it LonHecht. My email address is just first initial last name, LHECHT at 𝐓𝐢𝐦𝐻, CARE2 Go to our website, 𝐓𝐢𝐦.com, and reach out. Love to hear from you.
Thank you so much, Lon. This was an awesome podcast. I love seeing the innovation in the space. I love seeing how healthcare is being reimagined and really just providing better care for seniors and for everyone in the healthcare system that you guys serve. So thank you so much for doing what you do, and really appreciate your time coming on the podcast today.
Alex, I really appreciate it. It's been great. Now we have to talk about residential assisted living for me in New Jersey.
Let's do it. Awesome. Thanks, everybody. Take care.
Thanks.
Thank you for tuning in to the RAL Room Assisted Living Podcast. We hope you found today's episode insightful. If you enjoyed it, make sure to leave us a raving 5-star review. And a quick review helps more listeners find the show and more seniors get the exceptional care they deserve.
And don't forget to subscribe so you never miss an episode. And just so you know, we have prepared some free resources for you to help you succeed in residential assisted living in addition to this podcast. Head over to theralroom.com, that is theralroom.com, to download our free 10-step guide to launch your first or next residential assisted living home, or our 10 reasons to passively invest in residential assisted living ebooks.
And if you're ready to take the next step and make real moves in the RAL industry, join us in the RAL Room Mastermind. It is an exclusive community where we deep dive into everything you need to launch and grow your own residential assisted living business. You'll get access to recorded courses, live calls with industry experts, a RAL calculator, resources and tools, like-minded entrepreneurs, funding opportunities, and an expert networking community to help you along your journey.
Be sure to join us next time on the RAL Room Podcast as we continue to explore the world of residential assisted living with more great guests. See you then.